Welcome back to the Learning Commons at Kettering College for another edition of Kettering College Convocation Conversation. This time I'm talking with our Environmental Services Director, Mel Crawford. Let's head on in. I'm so happy to be sitting here with Mel Crawford today. Mel, could you just tell us your title and just tell us a little bit about what you do here at Kettering Medical Center in Kettering College?
Sure. My name is Mel Crawford. I'm the network director for Kettering, and I'm primarily responsible for all the hospitals, including most of our standalone emergency rooms. We support, obviously, the hospital and also support the college in providing cleaning services. And so my primary role is to ensure that we have a quality and safe program that provides consistent cleaning services that reduce the risk of infection, provides rapid room turnover for patients that are needing to have beds, and just making sure we're playing a consistent role with the patient experience.
Right. Now, I'm really curious about this. So coronavirus came on us hard in this spring, and I'm curious, how did coronavirus kind of disrupt what you all do in environmental services, or was it just kind of the newest thing that is just part of incorporated into your daily work?
Well, I think given the publicity of coronavirus, it certainly added a different element to our everyday. Truthfully, we've been cleaning human coronavirus the whole time.
Right.
It's part of our chemicals that we use. It's just that this strain of corona created such a sense of awareness on it.
High visibility.
That we had to make sure that everyone understood that, by the way, everything that we've been cleaning, we've always been cleaning. This is another one of those viruses that we have been cleaning. But we had to make sure that we re-emphasized the safety that was behind the cleaning and making sure that our staff was well protected and making sure that they were using the proper PPE, that they understood the risks of not washing hands, and making sure that even taking your PPE could be risky if you're not careful. So there was a lot of re-education that had to happen. We had a lot of emotions to manage, some reductions in the way that we were able to align our staffing models to make sure that we had that hyper focus on high-touch surfaces, and making sure that, because we knew how this virus could be transferred, and mainly through the hands, we wanted to make sure that we were really disinfecting those surfaces very well.
I want to ask about kind of the evolution of environmental services as a discipline, right?
Mm-hmm.
So environmental services has this team member partner role in our hospitals and even at the college, but it's a different kind of a role than we ordinarily think about in terms of like just regular, housekeeping or cleaning kinds of. Tell me a little bit about that.
Yeah, I think generally most people connect housekeeping to their experiences they've had in hotels. And the hotel housekeeping is generally really focused on the aesthetics of a room, the cleanliness of a room, where it's a completely different environment inside of a hospital, where we have to take particular attention to the detail because we have a focus on cleaning for the environment. Everyone that works inside of a facility, including our visitors and patients, are relying upon a clean and healthy building to work with. Not only do we reduce the risk of infection, we make sure that people are coming in and being able to come back and do their jobs every single day. And so it's a dynamic where people are counting on an environment to work from.
So there really is a much more direct connection between the work that our environmental services team members do here and the safety and well-being of the population here.
Yeah, I mean, we definitely are focused on serving the community, and it's when you think about the kind of work we do, we're asking housekeepers are really truly on the front line. They're the ones that are going to a room that has been previously occupied with someone with a highly infectious disease, and they do it daily, every day, without question, and they make that room safe for the next person. And so they have to do it with an intentionality of providing care. And we we really do emphasize that it is sacred because we do compete with hotels for the same kind of work, but it's a special person that specifically wants to work at a hospital versus someone who wants to work in another type of industry.
Yeah, boy, that really matters for the team, right? For the person who wants to serve as an environmental services team member. Boy, that I hadn't really thought about that.
Not everybody could do that, and you know, when you think about surgery, you know, you count on it's probably the most intense level of cleaning that we could do. As it pertains to the colleges, we want to make sure that the students and the faculty that come into our environment today come into one that they can feel safe in, be able to continue their learning, and also understand that they can help participate in the cleaning and disinfection of their areas.
So Mel, from your vantage point, then, what are some simple things that we can do that really have the biggest payoff for the time and energy that we're putting in?
Yeah, I think everyone has to participate in the cleanliness, making sure that if they have the tools available to make sure that they are cleaning after themselves, cleaning surfaces, as long as we kind of are all playing a role in disinfecting, we're finding this to be a very effective way of managing virus infection, you know, the spread of viruses inside our hospitals. We take that same practice inside the schools. So EBS would clean their general areas, but when you are when you're a teacher
or a student or a staff member,
everyone can play a role in cleaning things that they touch.
A president, whatever.
Either one. This kind of came from the philosophy that Planet Fitness, you touch a device, you clean it afterwards, you make sure it's clean for the next person, you get ready to use the device, you clean it. And so this is a good practice for us to get into, and also for students who can now understand as they practice their medical practices, they understand that how cleanliness plays a vital role, which before it maybe not have been an afterthought.
Yeah,
but
boy,
now it has clearly come to pass.
I think that's just a really important takeaway here is, you know, we're educating our students to be joining your healthcare providers and in our healthcare facilities, and so to be made aware of that at this stage is just going to be very beneficial to our student population.
Yeah, it's one of those things that we are hoping that we can create a culture that goes forward long after COVID is an afterthought, that we continue the practice of cleaning, that we continue the practice of practicing safe hygiene, the things that we know that are keeping the spread of infection from happening. Flattening the curve is something we want to do inside our hospital too, not just outside our hospitals.
Mel, it is so great for me and everyone at Kettering College to know that we've got a great partnership with across all areas of Kettering Medical Center and Kettering Health Network, and certainly none is more important than environmental services. Thanks so much for being part of this Kettering College Convocation Conversation.
Thank you for having me.